So you've heard a lot about the important role of volunteers and what they actually do and the big difference they're making in people's real lives. And I have to say, we cannot thank our volunteers enough for what they do. But on reflection, and we've been running for a number of years, what has been the kind of the stumbling blocks, the sticky wickets for an agency who's actually setting up a volunteer services? What are kind of the pitfalls and the things you need to watch out for? And I've listed only about 7 or 8 key areas you need to be aware of. One is professionals are not necessarily the best people to become volunteers. And I've said that in many videos I've made. And what I mean by that is not that professionals are not good. They're wonderful, great people. But sometimes it's very hard to actually get them to have a basic conversation with ordinary people without stepping into that professional role as doctor, nurse, therapist. I take control, I tell you what to do, etc. So I do think when you're getting your volunteers, you need to have a balance of people. And what we do is we use some of the highly trained professionals as our number 2s to give us additional advice. Should a volunteer be worried about someone, that they can contact them and say, I am worried, what do you think? So they have a role, but maybe not in the front line, but they're there in the back, in your ear, giving you advice as and when you want it. The other key issue is safeguarding issues. How do you protect the people that you're out there to support? Now, in the UK, we have a very strict process. All of our volunteers, we have police checks done on them. And that's important to us in the UK because at the end of the day, if you are going to be involved in people's lives, advising them, maybe meeting with them, doing interactive things with them, then it's important that we safeguard those people and ensure that all of our volunteers are people we can trust and who will not take advantage. And organisations who are responsible for coordinating the volunteers must ensure they have processes in place which safeguards the individuals, the very people that we're saying we want to protect. But also it's not just about the volunteer. We have seen cases where our volunteers have got involved with people and individuals when they become your friends, when you're patient, when you have the big ears and you're listening, suddenly people trust you and they'll tell you things about their families. Some very interesting things, which is fun, and most of them are lovely things about a family. But we've had cases where people say to us, it's funny, every time my daughter visits, money goes missing. Or I've asked a member of my family to collect my pension or my salary or whatever payments to have, and when they came back, I didn't get the full amount of money. We also have found people who are being physically abused by their relatives. And when that happens, you have to have a process in place that the volunteers can flag up to the agency and say, we need help here, we need someone to come in and do something about it. And that's important from day one. The other thing is, don't assume that all friendships will work. You might appoint a volunteer who says, I want to be friends with Mary or Jane, but things may not work out as planned. And that's normal. That's in our ordinary life, isn't it? That people make friendships and you break away from friendships. And sometimes, you will have both the person you're supporting and the volunteer say after 6, 7, 8 months, do you know what? We've had a wonderful time. We really have got on well together, but it's time now that we changed. Because sometimes the volunteer runs out of the ideas for one individual, and sometimes the individual gets to a point of functioning where they need someone else who's going to stimulate them in the road to recovery or re-engagement with the community. So don't assume friendships are forever. Time commitment, very important. You must not let down people. If you say, on Tuesday at 11 o'clock, I'm coming to see you, I'm going to ring you, you must be there. because many of those people you're supporting have nothing else to look forward to. And that Tuesday morning visit at 11 o'clock is the most important thing in their whole week. And they build themselves up to it. And if you don't turn up, they feel very let down. And it's also important that volunteers take into account when they're having holidays and volunteers become ill. So the agency supporting them must put something into place immediately so that the individual is aware of what's happening and not just sitting waiting for someone to come. Agencies also need to be very clear with the terms of engagement with volunteers, i.e., are they going to do police checks? What about out-of-pocket expenses? Are you going to pay if someone is driving to someone's house or they're catching a bus or other means of transport? This can cause problems if it isn't sorted on day one. Volunteers should know you're a volunteer and that's it. There is no contribution from the agency. So you know when you come in that is the case, or there is a contribution towards your travelling expenses if that is the case. So I think that needs to be very, very clear. Volunteers also need to have supervision. Volunteers are going to be listening to very emotional and at times distressful stories. And they're going to need help themselves. So the agency who is coordinating them must have someone who provides some supervision. And volunteers must always have a number, 24 hours a day if they need it, that they can ring someone for help and support if they're in a situation that they're worried about the person they're supporting or their own well-being. Agencies also need to do some light touch quality checks on how volunteers are communicating with individuals. In our organisation, every call a volunteer makes is recorded. And we can check those recordings anytime. And from time to time, we tell volunteers, they don't know it, but we listen into their conversation they're having with an individual. In that way, from a safeguarding point of view, we're protecting the individual and we're protecting the volunteer, because sometimes it's not just the volunteer taking advantage, which is very, very few, but sometimes an individual who might be suffering from early onset of dementia may accuse a volunteer of doing something. So by having these records, we're able to listen in and we can actually investigate quickly. But I think all agencies involved with the voluntary sector must protect both the individual and the volunteer. It's also important that volunteers can actually withdraw completely. We've had people who worked with us for 1 or 2 years and have said, that's enough, I can't make the commitment anymore, I've got other things in my lifestyle, some of them have become grandparents, etc. So you mustn't make a volunteer feel guilty because they're leaving the service. What you must do is celebrate. So finally, although there may be sticky wickets and mountains to climb, overall it's a very, very positive experience. And I have to say, in the UK, volunteers are making a real difference in people's lives. And I think when you look at the COVID-19 in the UK, we've had over 100,000 volunteers sign up to work with the National Health Service, to take people to hospital, to deliver medication. We've other people who are taking, going shopping for people and making sure that their well-being is looked after. So to me, the fundamental makeup in any community are the volunteers, because they are the real champions, I believe, in crisis situations.